Welcome back to Wellness Wave Radio. Thanks for tuning in this morning to ride the wave with us. Each week our goal is to give you at least one suggestion that will make your life a little better. My name is Phil George. I'm a clinical biochemist, certified personal trainer, and a health coach. Please remember, everything we discuss on the show is for informational purposes only. It should not be taken as medical advice, especially today. I'm going to get closer to you.
Okay, come on down.
Okay, there we go. Okay.
I don't have cooties, I promise.
So this is actually part two. We just did one just 2 seconds ago, but you won't see that until, you'll probably see them at the same time. So Emily, why don't you introduce yourself? Let's tell us a little about all your degrees and how you got more degrees than a thermometer. Tell us that.
I'm Dr. Emily Cabrera, and I'm a psychiatric mental health nurse practitioner. I've been at the bedside as a registered nurse for almost 2 decades. In critical care, I've been in academia as a dean, all the way down to teaching. No pun intended, like teaching is just as important as being a dean. And now this part of my career, I am a psychiatric mental health nurse practitioner.
Right. And I think when Emily and I met is one of the things, and I'm finding this more and more to do, and we showed this on the other thing, but doctors are getting burnt out. This is in the Telegram yesterday, saying that they just, in fact, I sent it over to you and over to Dr. Hamawi, basically stating that doctors are really unhappy right now.
And other providers, not just doctors.
Oh yeah, no.
Anyone who bills.
Yeah, nurses.
Insurance.
I know nurses. I work with. I'm not going to mention because I'm going to get her in trouble. But I know a lot of nurses, and they're not happy. Was a big lawsuit against various hospitals because there weren't enough nurses there. And the other thing, I don't know if you know this or not, but nurses actually have the highest incident of back injuries of any profession, including...
Because we have not enough staff, and your ergonomics are important, but if you need to reposition a patient, a client, whatever they're called, if you have to reposition a person and you don't have 30 minutes to be waiting for the physical therapist to be paged or appear, you do it yourself. Yes.
And that's why even more than, bricklayers and things like that, and nurses, you think, but they're lifting all the time. It happens over and over again. So again, and they're frustrated. There's not enough nursing staff. There's not enough aides to help in. But a lot of these CEOs of the hospital, they're making $2.5 million a year.
We know one that's around right down the street. Yes.
Emily, I'm confused. What could one person do to be worth $2.5 million? Can you explain that to me? So how are they making the hospital that much better at $2.5 million? Can you explain that to me?
Because they're bringing money into the organization, and they're hustling. But
no, what they're doing is they're keeping the cost. They're keeping the cost down. Because if I'm getting the MBA, we talked about this before. I'm the MBA coming out of Harvard. I have no medical training, but I know how to crunch those numbers. We just have to maybe have a few less nurses here, a few less PCAs there, and the rest of it. So again, this is the whole thing. We started actually even before the other show. We talked, again when I was working in healthcare, when you're working in healthcare. All little hospitals. I used to work at Holden Hospital. We had Fairlawn Hospital. We had Hahnemann Hospital. They were all individual hospitals. Because if I don't like Hahnemann, I can go over to Holden. You can't do that anymore.
No, they just did that with Harrington. They're joining these super organizations.
So they're all. There's 2 games in town. I'm not saying anything bad against either one of these 2 hospitals, but. What happens when they get so big that it's a monopoly.
There's a monopoly.
There's only two games in town, and there's a famous book, Wealth of Nations, by Adam Smith. One of the hallmarks in terms of economics, and he was saying that it's really basically having somebody that's a conglomerate like that.
Yep.
It's very, very dangerous because competition rules everything. So that's what's happened.
It's hard too, like on a personal level. So I am mental health focused. I'm a psychiatric mental health nurse practitioner. So I can prescribe and I'm able to bill for insurance. Registered nurses under a hospital do not bill for their services just based off of the level of our scope of practice. So we're part of the overall fee. You get a $50,000 bill for your insurance. from your insurance, whatever. Nurses are just part of that. Well, that bill comes from what they're charging. Your surgeon charged this, the attending doctor charged this, the nurse practitioner charged this, supplies, whatever it is. They all come together. So as a nurse practitioner, I can use coding for insurance to get reimbursed if I do insurance. The mental health perspective, so when you have those conglomerates, those monopolies, they change the narrative and they do a lot of hustle, purposeful hustle, to get people who are doing private pay practices. This is a fact. I will argue anybody about this. It's just a matter of how serious you feel about it, right? They will change the narrative to try to change the perspective that if you're a private pay practice, you are only in it to make a ton of money, or you're in it for the wrong reasons because you're going against what Western medicine is. And you almost get exiled a little bit within the community because you're not conforming to what these monopolies are doing. Does that make sense?
Yeah, absolutely. So again, the whole thing is, I think everybody knows the medical system is broken. This is a fact. We pay the most for any industrial country in the world for health insurance, and we have the worst outcomes. So we're paying the most for the worst. In fact, we're doing, the Greendale Y just hired Kelly and myself, Kelly Hamilton, she's an ICU nurse and a holistic nutritionist, and they hired us to go in there. We're going to do the first one. It's called 70 Years of Madness. Way back in the 50s, everybody was healthy. Now everybody's sick. And I looked it up just to see. I ran it through AI, ChatGPT. So it's legit.
It is great. Yeah, ChatGPT. Is it like Wikipedia? Did you get resources from Wikipedia under ChatGPT?
No. Well, I'll do a couple just to make sure. But this wasn't it wasn't political or anything, so there's no reason for them to lie. But back in the 50s, we were the #1 country in the world for healthcare, and we were the lowest price for healthcare. So 70 years, we went from the best, least expensive to the worst, most expensive in 50 years. So what happened over 50 years? What happened, the whole
wait to hear.
Food system, everything else. So this is what the seminar is about. So if you want, actually email me, philgeorge@charter.net. We're doing that at the Greendale Y. I'll be there, and my collaborator Kelly will be there. We'll do that. We're giving out prizes too. So email me, philgeorge@charter.net, if you want to see where we went wrong. But we even talked before the show. I saw it in this morning that we have contaminated baby food. So we have contaminated baby food.
Oh, yes.
So, and this is not the first time this has happened. Okay, and you know, because I told you, because that's a cheat. So, do you know who the #1 company is that makes baby food? You know.
I know, but I wonder if the listeners know, the watchers know. Nestle, the people who make your chocolate bars.
But you think it's Gerber because they own Gerber. So what's happened now? The other thing, in terms of the big tobacco companies, now they've gone into trouble, but they had a really good marketing campaign. They had, more Dr. Smoke Lucky Strikes than anything else. I have another, a really an interesting thing for you. So what happened is, what the heck's his name? The nephew of Sigmund Freud. What happened with him is that he was the beginning of the whole thing in terms of advertising. And what he did is that when the big tobacco companies, they came out and they said it was considered to be very unladylike to smoke at one time.
It was also very unladylike to shave your legs.
Yeah.
Just saying.
Yes.
And your armpit. And now look where women are now.
But okay.
100 years ago, they never shaved.
Yeah, but what happened with that? They were saying that he was. The advertisers came to him. The tobacco company said, "Look, we're missing half the population." So what they did is, this is towards the time of American suffragettes.
Yes.
We want to be equal with men, and this, and this. Yeah. So what he did is he hired a whole bunch of actresses on the Thanksgiving Day parade, and they called them freedom sticks. So we're going to smoke. We're going to be just as good as they changed. His name was Edward Bernays. In fact, he worked for the Nazis. in terms of getting people, and that's what happened. And you know, the engagement rings, he started the whole thing. There were no engagement rings before that. Beers hired him, and that's when the guy went down to one knee with the thing. So what happened is they got people convinced to do this type of stuff. So again, all the companies now, they're buying up everything, so everything's under one. It's Nestle's owns Gerber, they own something else, they own something else. But you were saying what you did as a young mom in terms of what you did with the kids.
Well, I had good influences in my bubble. Your bubble are the people that support you. So it was my mom and other friends that we all had the same opinions. I made all of the baby food for my children. It's actually pretty easy.
You boil, right?
You boil it, you can bake it, you smush it up. But even beyond that, I breastfed for as long as I could. My girls are 11. I have identical twin girls. I was like the milking cow where I just laid there. But I wanted to. I was dedicated to it. Some women can't produce enough milk. Like, there's so many variables, and I am not giving an opinion. I'm just telling my experience and my values. And some people can identify with that. And then other people might say, oh, well, you're judging. No, I'm not judging. I'm not judging. So this is a very sensitive topic, and I want to make sure that I say that. Breastfeeding is a very sensitive topic. But babies are not wired to start eating really 9 months to a year, regular food. They're supposed to be breastfeeding. Sometimes people find value in feeding 3 months, 6 months, because they want more sleep, because it's what they've been taught, it's their bubble, it's the narrative, right? Like, so there's lots of different reasons why people do that. But for me, my mom was a hippie.
Yeah.
She taught me natural way, and it was ingrained in my head, and I wanted to make sure I did that, and I'm so proud that I did, because now I find all these and I knew because of my education that I needed to take control over the health of my children. So I just smushed up all the foods that I wanted to give them when they were ready. I don't think my children had any food until they were about 10 months old. We did all breastfeeding, and I did have to give some formula. I had 2 kids latched onto me. I was anorexic by the time. I looked so unhealthy because they just sucked every calorie from me. They're like little aliens. I loved them, but I had to supplement with some formula, and that drove me crazy. But you do what you have to do. Anyhow, I just wanted to go down that road of making my own food. But it was actually really easy. But it was because I had people to support me, and they taught me how to do it, right? Like, there's like the manual blender.
But now, we got YouTube.
We do have YouTube.
You can just go over there, and YouTube can show you how to do it.
But it's the narrative. So so there are 2 big monopolies in our area, right? Like, can I say the names? Am I not allowed to say the names?
Yeah, everybody knows. Okay.
Okay, St. V's versus UMass.
Yeah.
Okay, I was a UMass nurse. I'm a UMass nurse, okay? True and true. I was a bedside UMass nurse for over a decade. Those are my peeps. And I'm a UMass memorial nurse. That's different than university. Oh, we can get down all these hard emotions, bringing out the mental health person in me. University nurses and memorial nurses are like fire and ice,
no.
Which is crazy.
Why is that?
Crazy. Union and just crazy town, right? Like, and we're all normal people, like whatever normal means. We all should get along, right? Anyhow, so I actually delivered at St. V's because I didn't want my friends to come see me and infect my children.
Wow.
What happens? You deliver your babies. This is going down a crazy road, right? Like, now I'm really giving you my insider, so you know what I was thinking back then. No, but your friends come and visit, and then they want to kiss your babies, and they want to touch their hands, and they're working a shift. I was working in the ICU. You know how many germs are in the ICU?
Oh, sure.
And I had twins. I was lucky to get them to 37 weeks. They were little babies.
What was the birth weight?
6'1" and 5'7".
Not too
but
bad.
They both went down to 5'6" and 5'1". 5 pounds, 1 ounce.
Wow.
I was a nervous mom, of course, And I had knowledge, which was even worse. Like, I knew what could happen. I was on the rapid response teams. The moms, after they delivered, just moms and not even the kids, they crashed and burned if that was a rapid response. I've had, assisted with moms that died. Like, it's horrible. So you have all this knowledge in your brain of what could happen. And it could start from an infection. That's what I was worried about. All my friends visiting, oh, your kids are so cute, giving them kisses and hugs, and they have all these germs on them. So I actually delivered at St. V's. Well, I think things have changed a little bit, but when I delivered 11 years ago, UMass was very heavily grounded in supplementing. They were not a breastfeeding positive institution. Things have changed. I hope so. St. V's was breastfeeding. The second you were born, you birthed your children or child, they had the lactation consultant there. We're here for you. Come on, let's go. I'm going to help you latch. UMass was not like that. I had friends that worked there, like in mother, baby, and labor and delivery. And they're like, come on, we got to go to the next delivery. Like that's being kind of raw, but it's true. So I also wanted to support my breastfeeding. The first day or two after you deliver, if you are being saturated as a new mom, you have your hormones acting crazy, you are so stressed out, now you're a zombie because you haven't slept and you're paranoid that something's going to happen to your children, right? Or something did happen and you are rightfully paranoid. UMass, another thing. Labor and delivery is on one floor, the NICU is on a totally different floor. I had 2 babies to think about. If I split my babies who were used to being in utero and they were a part of me, and now I'm split between 2 of them, oh God, that might have just sent me over the edge. St. V's, it was right down the hallway. And I could bring my other baby with me as I had one in the special care unit. So like I had to think about all these things, right? But at that time, UMass, remember how I said the first 2 days are really important when you're trying to support breastfeeding. And that breast milk is so important, the colostrum for your baby,
yeah.
right? For their nutrition, talk about nutrition. If they're giving you pamphlets, just bottle feed. Get them to get enough nutrition from Nestle companies that make your formula just to basically shut the kids up. That's the truth, to make them filled up enough so that way they're not crying and they're not miserable and they're not trying to suckle because the mom needs to take a nap. Versus, for me, St. V's, shout out to St. V's at that time, no, you're not, we want you to sleep, but never once did those nurses tell me to take a nap. They were like, do you want to try to breastfeed? And that really supported me. I went down the whole feminism thing, but I'm a feminist at heart.
So wait, I'm glad you mentioned the colostrum because when I deal a lot with people with gut issues, and so I'm glad you said it. So can you tell can you tell the audience again what colostrum is?
Colostrum is the first round of milk that comes in, and it is full of so many great nutrients, fat, and
globulins.
Positive nutrition that will support you for your kids' allergies later on and autoimmune disorder, and give them, there's more calories in colostrum than any of your breast milk afterwards. That colostrum is so important.
But guys, this comes from all mammals, okay?
Yes.
So I take colostrum and I give it to my wife every day, okay?
Do you?
Yeah.
Oh, okay.
So from grass-finished happy cows, they're walking around, they're eating grass.
Yeah.
I have a lot. This is something
So
I recommend.
healthy.
Okay, and feel free to email me, philgeorge@charter.net. You have to be careful where you get this from.
They're really going to think that you're earthy crunchy now.
Yeah. No, this is big time science. This is big time science.
This is fact.
So people with gut issues, the first thing I put them on is colostrum. So you get there. It's in a powder. You can put it in your milk. You can put it in anything. It's really going to help with your gut health. And as Emily mentioned, you have what they call immunoglobulins, which are antibodies. They're in there. They're going to eat up all the bad stuff. So that's something else. That's something else you can do for yourself, for your kids. So there was you ever watch Shark Tank? Okay. So there was 3 pediatricians that went on there, and they came up with this thing because so many kids now have allergies to everything. And
Peanuts,
they put
yeah.
it's something called an antigen. Antigen is something your body gets used to or attacks. So they put the little peanut things in there in the actual baby food or the milk or whatever. So then
Desensitize.
so the kid's not going to have any problems.
Any allergies.
Because the other big study, I know you know this, is kids that grow up on a farm, they don't have any allergies.
No allergies.
Because
But what's happening is we are back in a rhythm where many women are not breastfeeding. That colostrum is not being given because they're working. It could be their education, meaning the people around them talking in their ears, right? Like, there's lots of reasons why they just don't want to. They don't want their kid, latched onto them. Like, there's so many different reasons, and all of them are valid. We are not passing judgment, but there is direct correlation between our time right now and the amount of allergies and the moms if they breastfed or not, and getting that colostrum, and then subsequent breastfeeding, right?
I have an idea for more clients for you.
Oh.
So what happens?
Because part of my business is that women's health. I have nurse practitioners who work for me who support that.
So
Just
again,
saying.
if you have somebody maybe that's pregnant or you want to know, I've had doulas on my show, and a doula basically is just somebody, they work. They're not a nurse, but they work with this stuff. And a couple of weird stuff, actually giving birth inside of water.
I know. That's not weird. That's
I'm not
how
saying
it
it's
should be.
weird. I'm not saying this. I'm just saying it's unusual. I shouldn't say weird.
Makes you nervous, but
unusual.
I know.
And babies can swim
Yeah.
when they're born. People have realized that they can actually swim in the beginning. So again, if you have a wife or a daughter or something like that, and they're it's maybe a good idea. Because Emily's been through it, so she can, and she's a nurse and she knows it. Knows what's going on with that, and she can kind of give you maybe this is the best hospital to go to, or maybe you should think about this or thinking about that, because what happens is the other thing I've got to ask you, was it a C-section or normal delivery?
I had to have a C-section.
Okay.
I had no option, which I had to do my own mental health grieving from that, because in my head I'm like, I'm going to deliver my twins at home and a medication-free birth. Boy, was I crazy.
Yeah, but you got to be with twins.
I had to. Yep.
But a lot of people, and feel free to jump in on this. So what I've heard anyway, a lot of the times, what happens if you have a C-section, the child is much more susceptible to allergies and diseases, because what happens is pretty much the birth, the whole in terms of the womb, it's basically sterile.
Yeah, when you're being pushed out and going through the vaginal canal, that's good bacteria.
That's when you get all the.
And they
It
bring
goes
it
into
in
the
their
mouth.
Yes.
So what I've heard, and feel
Yep.
free to jump in on this, if the more advanced hospital, you get some vaginal swab and put it on the baby's mouth. So what happens is
So important.
because if you don't do that, whatever's in the birthing room right then, you're breathing it in. You don't know what the heck's in there. So by because you're getting a natural immunity from
Colonization.
from the colonization. So that's another takeaway. So if you they mention to your OBGYN or whatever that's what you want to do. Did you actually do that?
I did.
Oh, wow.
They did it. They did it. The nurses did that.
Boy.
They were amazing. And that was why I picked St. V's.
Wow,
It's like the ebb and flows. Is that the right wording?
Yeah.
Up, down. St. V's is better than UMass. UMass is better than St. V's.
Probably different things.
On different things. But for me, I made the best informed decision. So shout out to all my nurses at St. V's at that time, 11 years ago. You know who you are.
It's funny. I've said this to so many people, and either the medical professionals, about the swabbing with the C-sections. And I also heard C-sections are really up right now because it's convenience.
It's convenience.
Hospitals like it. A lot of the women's like it because they can get in, they get out, and it's for whatever reason.
We can go down an insurance frustration that I had though about St. V's, but this is just the model, the business model. So they had neonatologists that were in the room, like in the area. They charged me double because I had 2 kids, and the neonatologist never even walked in the room.
Wow.
But that's insurance. They'll try to get you for anything. It's just. I couldn't have paid privately for a delivery, especially C-section, and I had to be in the hospital for 5 days. It was a lot. But don't overcharge just because you want to get extra money. But that goes to the article that was in the newspaper. So the practices that are based off of that insurance-driven model, they will literally try to upcharge you on purpose because they're hoping to just get some reimbursement. That is a real thing, you know.
But I think the other big thing is, you see all the time, you've got to be the CEO of your own health. You've got to do this stuff. But people do not have our background. They don't. I mean, you know, I don't know how to fix cars. They know how to fix cars. I mean, I don't know how to fix cars. I'm going to get a mechanic to fix my car. I'm not going to try to do it. You need somebody. In fact, I toyed with the idea. I'm not going to do it of becoming, it's called a patient advocate.
Yeah,
where
love it.
I would go in with it. When I've done this with friends and relatives, I will go in there and I'll talk all the medical mumbo jumbo stuff.
Yeah, you know what they're saying behind your back. Oh God, here we go.
Yeah,
no,
see,
I don't tell anybody I'm a nurse or a doctorate.
I let them know because what happens is then they're going to say that this guy actually knows something. We better not screw up. Have you done this? I do it. Have you done this? Have you done this? Have you ordered this? What's your H&H? I give all the medical mumbo jumbo stuff. You know what I mean? So. I think that's
then they're going to go roll their eyes at you when they
walk
walk down the hallway.
But it's
worth it if you're advocating for your friend.
If they know, that you know, they're going to treat you entirely differently. And it's just like if like Art knows about cars. If he goes in, he's going to talk all the car, and you're the Corvette girl and boy here. You're going to talk this stuff. You'll be able to talk the lingo, the nomenclature. That's what's called the nomenclature. You'll be able to talk it. So it's a good idea to have somebody around, like Dr. Emily, that can walk you through it, or you can even go to the doctor, and I give them notes and stuff. Ask them this, and this.
Yep.
And then,
as the nurse, we are the #1 family member that gets asked, "Can you come to the hospital with me? Can you?" Because we're a nurse. You know, like I could have been home care and hospice nurse, and I'm getting, you know, which I wasn't, but you'll get asked to go to the ICU just because they know that you're a nurse.
And nurses are the most trusted profession
for a reason.
Of any.
Boop.
Yeah. So
it's true.
That's what it is. And again, with Emily, with all of her degrees, all of her stuff, she can draw from a lot of different areas. My wife likes to joke with me. It says I'm just a wealth of useless information. I know
not useless.
I know a lot of different things about a lot of different things. So a lot of times I can pull it from, like an engineer, I can pull it from somewhere else because I want to be the medical detective. You come in. Oh, in fact, I had it on my radio show. I think you were on that show. Somebody called in and they said, I got this kind of pain here and blah, blah, and I got this, and this. And I said, you have this, and this. And I said, sounds to me like you have SIBO, which stands for small intestinal bacterial overgrowth, SIBO. And her name was Kathy. I remember Kathy. And Kathy called back and says, you know what, you were right. That made me feel good. So again, I'm not diagnosing, but I'm trying to figure out based on what it is. So with all of your years' experience in terms of the hospital, they can come to you and say, blah, 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 blah. It's going to go around your head. This sounds like it's probably this.
Well, that's the good thing about being private practice for, mental health is unless they're really in an acute phase, I don't need to prescribe right away. Let's do some digging. I want you to get some labs. I want you to start on a multiple vitamin, try to cut out the Sour Patch Kids a little bit. Like you can make small steps. We're in it for the marathon, right? Maybe it's just establishing our relationship. And then while you're at it, let's talk about who is your bubble and who do you have as support systems. And maybe we do some cognitive behavioral therapy and we have time to do that. That's the great thing about, kind of being in your own business model. It is a business model. And your philosophy. My philosophy through my business is I'm going to treat the whole body within the context of my license that allows me to be able to practice as a nurse practitioner.
But as you also told, Emily and I both have a pretty large what's called Rolodex. We got a lot of trusted people.
Yes.
And I don't recommend anybody. I have anybody on my show that basically I don't use or recommend myself. So that's one of the things. So if it's out of our like a vascular surgeon, I have a vascular surgeon I can put you over right now. I got direct primary care doctors. I've got dermatologists. You name them. Between the two of us, we have a ton of people. I may even go. In fact, I get that email from a listener. Do you have somebody? I got a person that has a lot of mental health issues and a lot of pain. Do you know somebody? I know somebody.
Yep.
We're coming up into the show. So Emily, how do they reach you again?
Okay, so you can go to my website, www.dualmindspsychiatry.com. The name of my business is Dual Minds Integrative Psychiatry. You can also call me, 508-233-8354.
Or email me, philgeorge@charter.net. I'll shoot it right over to Emily. Thanks so much for tuning in, guys. Emily, this was so much fun. Thanks for coming on.
That was fun.
One of the most common questions I'm asked as a biochemist and health coach is, what are the best supplements to take? Choosing supplements is a tricky business. Many companies have poor quality control and questionable ingredients. In the past, I had to send clients to several different websites. I am now able to offer one-stop shopping for all the quality brands I recommend with no shipping cost and a lower price in most cases. Just email me, philgeorge@charter.net, for a free consult.